preparation for my upcoming book, A Womanist Guide to Self-Care, I wanted to spend a minute on health equity, answering the question, what is health equity and why is it important? So simply, health equity means that everyone has the opportunity to be as healthy as possible, regardless of their circumstances. And this is achieved with several steps. And that includes improving diversity and minority representation in clinical trials. And that is, for me, I can provide the experience of being part of clinical trials related to Black women and breast cancer. And definitely during the time period when I was participating in those trials, there was not a lot of representation for Black women or women of color. Other steps can include studying health disparities that disproportionately impact minorities, minority communities. And definitely Black women, we have our share of health disparities when it comes to just being, having higher mortality rates when it comes to heart disease, cancers, diabetes, lupus, and there are many others, unfortunately. Providing access to factual health information that is easy to understand, that's culturally competent, and available in a variety of ways and a variety of languages. After all, we are looking at making sure that we have equity, not just equality. So equity versus equality. They sound similar, but they are totally different. There's actually big differences between the terms equity and equality. Equality means that everyone is given the same resources, and equity is recognizing that some individuals or groups need something extra or something different in order to have a positive outcome. So examples of health equity include providing lower cost services to those with lower incomes, offering evening or late night health appointments for those who work longer shifts, have different I'll just say non-standard, not working the regular, they're not available to come in to a doctor's appointment or a clinical appointment between the hours of 9 and 5. And then prioritizing education, testing, and treatment for communities that are disproportionately impacted by certain health conditions. And we all have seen what COVID-19 has done. So why is health equity important? Well, the Center for Disease Control's Office of Minority Health and Health Equity says it best. Persistent health disparities in our country are unacceptable, and correctable. Health influences happiness and overall well-being, so it's only logical that everyone should get the opportunity to be as healthy as possible. And I know self-care has become this real big buzz, but self-care is not something that's distributed equally because of resources, because of some of the social issues that I've talked about. Self-care is, I'll just say it, it's not cheap. It costs money to have quality food, not just access to the food, but being able to have quality food, fruits, vegetables, etc. And with COVID-19, I'm going a little bit off topic here, but I have seen where many people are starting their own gardens at home. But anyway, health equity, it involves breaking down barriers such as discrimination and lack of resources that lead to those inequalities. It means recognizing that some demographics require additional resources, and opportunities in order to reach their full health potential. So if we want to practice self-care and encourage folks to practice self-care, they need to have available resources. So what are the health disparities? I talked about a few, but health disparities refer to differences that impact one's ability to achieve optimal health. Examples of health disparities include race, gender, education, income, sexual orientation, geographic location, mental health, physical and cognitive abilities. Health inequities are the direct result of these differences in health outcomes among certain groups of people. So what are social determinants of health? Social determinants of health are the environmental conditions that impact or affect one's health, well-being, and quality of life. Social determinants of health can be grouped into 5 categories: economic stability, education access and quality, healthcare access and quality, neighborhood and building environment, the neighborhood and the type of housing you live in, and then 5, social and community context. So these social determinants of health can also contribute to health disparities and inequities. For example, an inability to access healthy groceries, like I talked about a bit earlier, due to income and or location can lead to poor nutrition. Poor nutrition can lead to a higher risk of heart disease, diabetes, and obesity. So it's important that you have access to quality healthcare, quality food, quality neighborhoods, because we can talk about going outside, getting fresh air, and riding our bikes, going for walks. But if your community is not safe, you can't do that. And so that is, again, part of the social determinants of health, and then creating spaces and places where there is actually equity. So achieving health equity requires a collective, organizational, community, political, and individual efforts. So when I talk about the womanist ethic of care, there's a space and a place for our community as it recognizes Black women's lived experiences when it comes to health, when it comes to wellness. And when Black women are healthy, our communities are healthy, our children are healthy.